All right. Well, good morning, ladies and gentlemen. This is Mark Herzog. I'm the Executive Director of the Virginia Biotechnology Association, and it's my pleasure to welcome you all to our first webinar. Today's topic, as you know, is the financial markets, and we're very pleased to have a fantastic speaker with us today, Dr. Jeff Meacham. I wanted to point out, though, that this would not be possible if it weren't for the great financial support of Cooley Godward Cronish, a law firm that specializes in technology, especially in the emerging bioscience area. And they've been longtime supporters and sponsors of the Virginia Biotechnology Association, and we're grateful to them for that support. So for the webinar today, what will happen is that we will turn things over to Jeff, and he will speak to us for approximately 10 to 15 minutes. And at the end, if he still has time, we will take some questions. There are two different ways to pose questions. The best one, frankly, is that towards the end to click the icon that essentially virtually puts up your hand, and then we will, at the end of his remarks, go ahead and unmute your phone and let you ask the question directly to Jeff. The other way is to text through the chat log on the right side of your screen question, and that way we can take a look at that and see if we get a consensus of the kinds of questions that might be asked. So either way, you're welcome to go about it in that way. So with that, we will now talk about our speaker today, Jeff Meacham. We're very pleased to kick off this event with Jeff. He is one of you in terms of his background as a cell biologist. And what we will do is let Jeff go through a little bit about J.P. Morgan and his background, and then he will begin his formal remarks. So with that, please welcome Dr. Jeff Meacham.
Great. Thanks a lot, Mark. And hi to everyone on the phone. So I'm happy to be doing this. It's a great opportunity. I'll just give you a quick bio here on me. So I've been with J.P. Morgan for about 5 years. I'm the global head of biotech research. We have another analyst, Corey Kazimoff, who covers small-cap biotechs. I tend to focus a lot of my time and effort on the 5 large caps, and we have another 10 other small caps under coverage as well. So I'm a science nerd by training. I have a PhD in cell biology, and I've worked in the industry for a couple of years. But I've been in finance for about 10 years or so. I moved to the quote-unquote dark side in 2000, right after the kind of the genomics bubble really burst. I'm moving to New York and working for UBS and covering pretty much the genomics and early stage biotech sector. And at J.P. Morgan since pretty much '04, I've been covering the large cap group, and it's been a lot of fun. It's a very, very dynamic industry, and I don't tell my boss this, but I really I'm thrilled to come into work every day. So a lot of my effort and my time is focusing on talking with investors and really getting their appetite for the industry and for upcoming events and for earnings and for really to focus on fundamentals. And so what I'll do is just talk about kind of where we were, 2008, and then the sentiment this year and how it's changed over the time throughout the course of the year, and then what we have to look forward to. And we'll talk a little bit at the end about things like M&A, therapeutic areas that are interesting, and then access to capital, which is a very key topic here, given that the window officially has been shut for a number of years, which is quite rare for the industry. So, where we were for 2008. So as it turns out, large cap biotech was actually the best performer in an industry category or subcategory in the S&P. And a lot of investors were looking to the industry, to biotechs to sort of protect themselves from any economic sensitivity. And that thesis worked because, after all, if you have cancer or HIV or diabetes, you typically don't skip your meds, and you typically go see your physician as often as you're supposed to. And the companies really throughout the entire large cap space, they all did very well last year. And so we started 2009 really with unfortunately biotech being quote unquote over-owned by institutional investors. And I remember this day quite clearly. It was really the mid-February when Obama's healthcare proposal, the budget blueprint, so to speak, came across the wire, and it really was the first shot across the bow for healthcare reform. And that was a week where biotech, at least large cap biotechs, probably were down 15 to 20% on the week. And since that time, this has been the one theme that has plagued investors in a major way.